What's up, everybody? This is me, Dr. Bar2 on Pill Talk. One of my special guests. He coming back to return to give us some good information on the COVID-19 vaccine. Everybody, this is my special guest, Dr. Jimmy Pruitt, who's an Emergency Department Pharmacist. Hey, Jimmy, how you doing today?
It's been good, man. I've been fortunate. I've been blessed to get ready to start off this new year. Thank you for having me on again. We had a ton of fun the first episode, so we had to run it back.
We had to bring it back, man. Needed to share some of this knowledge. I'm a pharmacist in the retail, you're a pharmacist in the hospital. We both out here helping, trying to save the community, trying to make sure everyone is doing their part. Definitely with this COVID pandemic and with this new COVID vaccine that has just been released. So I want to get your intake with the COVID vaccine first. Can you give us a little bit of information about the COVID-19 vaccine, please?
Yeah, so it's a loaded question, but I'll just start off, do a quick overview of what it is and some of the mechanisms and just give a brief overview because I've gotten a ton of questions about it. So in frank detail, there are a ton of COVID vaccines that's out there right now, and I think most people don't really think about how many there is, but there's about 10 to 15 that may make it to the market this year. Okay. But the main two that are approved right now is the Pfizer vaccine and the Moderna vaccine. And those two vaccines are going to be using this mRNA technology, which everyone is very concerned about. This is the first of its breed. And I posted on some of the stuff in my podcast about this. I had a question hey, this is a brand new vaccine and how does it even work? So to break it down in very simple terms, we have this message that is the RNA for most of us, then it's going to be injected inside of us. And once it actually reaches the cell, the body gets that message and say, hey, the message says, make this protein. And that particular spike protein is going to be, which is going to be housed on all of the COVID-19 actual virus itself. And once our body recognizes that protein that we make, the message itself is eliminated. All mRNA that's in the body is eliminated after it's made the protein. So that first part is going to be completely eliminated by Excel. I'll cut this part out. That's what it's called. By this. So all of the mRNA is going to be eliminated through the body just by the mechanism of how it's made. Once you make the protein, that's also going to be recognized by the body, destroyed by our incredible immune system. And once it's going to be destroyed by the immune system, the most important part is the fact that it's going to leave behind antibodies. That way we can fight this virus in a more impactful way if we're exposed to it again. The good part about all of this, again, I always say it's temporary, that the message is put into our body, and then we have long-term immunity, long-term remembering of the virus and how to attack it. So that once we actually come and exposed to this virus again, the hope is that we're able to inhibit the reproduction of the virus to where it makes us sick. But more importantly, which I think we're getting more information on from other vaccines, and I believe in probably about 4 or 5 months, we'll have more information about asymptomatic spread. And my personal belief of how that works is that we have such low viral loads that it's hard for us to be able to shed that amount and cause an infection to another person again. I caveat that I'm not an infectious disease trained. I caveat that I did not make the vaccine. I caveat all those things. Just my personal belief of what I've read and personal belief of what I've seen other vaccines work. So that's more of the mechanism. Again, only of the 2 mRNA vaccines that are available right now as of in early January of 2021. There's a host of others that may come through that have completely different mechanism how they work. So I'm only speaking towards those.
All right. So just in layman's terms, so the vaccine has a mRNA, which is a message for the DNA for your cells that you're going to be injected into you through the vaccine. Your body's going to take that message and it's going to be like, hey, let's make this antibody. So when we do get in contact with COVID-19, we have a way to produce and fight the virus. And that's how we build immunity through the vaccine. So everyone know how the actual vaccine will work.
Yeah, and I think the only caveat is that the DNA is not heavily involved in this. I think that was another component. The DNA is not involved the RNA just makes the protein, and then it's eliminated. That RNA is no way in contact with our DNA. Again, my understanding of it, and then we make the protein, which then we eliminate, and then we remember how to eliminate that protein once we're exposed to it in the future.
All right, great. So the vaccine, most people know it's a 2-dose series, and both Moderna and Pfizer has 2 doses, but their timing is a little different. Can you explain both timings of the vaccines? Which one is 4 weeks, which one is 3 weeks, and et cetera?
Exactly. So the Pfizer vaccine, again, is going to be at least 21 days after. So that's going to be the 3-week one. And then the Moderna is going to be the 28 days. We say that's how it was studied, because what's going to happen, since I'm being able to see this now, is how we schedule to get it is going to be, it may be in that window. Once you get the vaccine, a lot of people would not be able to, due to the workload and just the availability, be able to receive the vaccine exactly 3 weeks after. So there's going to be a range that I see, but it's going to be a little shorter for Pfizer. It's going to be a little longer for the Moderna vaccine. So we're going to be, say, around 21 days for the Pfizer and around 28 days, because I think I don't want people to panic if they don't get it exactly this many days after.
Yeah, I definitely understand that. Want people to know that it's a recommendation to get it on the 21st day or the 28th day, depending on the vaccine that you receive. Okay, so now we know how the vaccine actually works. We know how to administer, or how the series works. Do you know of anyone that has received the vaccine?
Yeah, I would say that the majority of people who I work with, I'm in the emergency department, and the people who I know that's also working in the department have already received the vaccine. I myself have received the first dose of the vaccine about 2 weeks ago. I'm getting ready to receive my second dose next week. So I would say the majority of people have received it. And I've just been so disappointed. I don't have a horn on my head. I haven't got superpowers. I haven't had all of the side effects that I've heard within the lay public. Not to say that fact that there's no side effects to the vaccine, but the ones that were popularized on social media, I have not met anyone who have had those.
All right, so I'm glad you brought up the side effects and the ones that people are scared about because they believe that will affect them or happen to them. Can you go down and list the side effects people should look out for once they receive the vaccine? And Absolutely. From your experience, what side effects did you have? Absolutely.
So one thing I can say based off the studies and based off talking to individuals, there's a high probability of these side effects I'm going to talk to you about. It's most likely going to happen. Mm-hmm. Fever, again, about 11% of the people who we got it in the vaccine, and we're getting anywhere from 5 to 11% actually had a fever after it. That meaning that the body recognized something wasn't there and actually mounted an immune response. Okay, that by itself, to me, rather mild. I did not have a fever after. I didn't feel one. I get my temperature checked every day at work. Yeah. That didn't occur for me. The next thing that can occur, and I think it was, I'm looking at the chart here, I think it was the most common side effect that occurred was fatigue. Mm-hmm. Just being tired. Malaria, again, anywhere from, I'm looking at about 20% all the way to like 51%. Again, looking at Pfizer's data, had fatigue. And what happened was a lot of individuals combated this by getting the vaccine the day that they were actually going to work, or like after they left work and was off the following day. I did not have any of these symptoms. I didn't have fatigue. I actually went and worked out the next day. But I did know a colleague that was a little tired 2 days after, and she just didn't want to come in. So again, I see this will happen. The next thing that occurred in about a third of the patients was headache. Again, this is more common in the vaccine to the placebo. Again, a good percentage of those patients, again, about a third of those had that. A little less, about 15 to 20%, depending on which dose or what age you were, got chills. So all these things that make you feel like you're sick, people got those things.
Yeah.
And everything, all of these symptoms make perfect sense compared to how the vaccine works and how vaccines in general work. I also caveat this by saying, because I've seen this on people who are very, very popular within their communities. The COVID vaccine does not give you COVID.
Yeah, please explain that again.
Again, it's almost impossible for, again, the current vaccines that are on the market to give you COVID. These are not live vaccines. This does not have the actual thing. This has a message that says the bit of protein that is familiar on the surface. Again, it's like saying, okay, we have a message that encodes for tires. So everything that has tires is going to go ahead and eliminate that. We're not saying we're giving you a Rolls Royce.
Yeah.
So it just doesn't work that way. Again, I've seen and heard these things, and people come after me and told me, oh, I know someone who got the vaccine, they were sick the next day. Yes, your body forms an immune response and attacks that protein just as it would the virus. So that next way you're smarter and you're well prepared to fight this virus if you come in contact with it again. So again, you have that, you have muscle pain, you have joint pain. You can have these are the most common symptoms that have been studied. Also, these are the most common things I hear patients and people who I know who've received the vaccine talk about. So these things will happen. Again, it didn't happen to me. But again, I always want to caveat that nothing's perfect. You're not going to feel amazing after getting this vaccine for a few days. And it seems that these things occur a little bit more after the second dose. So I may not be in the clear yet because this is all based off people who got the first dose. So I just caveat that.
Great information right there. So basically what you're telling me, just like any vaccine, you're going to have the redness, soreness at the injection site, muscle aches, and a mild fever. It's going to give you the same symptoms such as a flu shot or a Tdap shot, particularly, right?
Absolutely. I've received all three of those vaccines in the last month. So I can definitely tell you. So I can definitely tell you that these things can occur, and I didn't feel any difference from that vaccine, the Tdap or flu versus this one here at this point.
Man, that's good. That's good. The vaccine just came out, and it's not readily available for the whole community. There's only a small population that we're trying to get immunized right now. Do you want to talk about that, and who are the population that we're looking for first?
Yeah, absolutely. So right now it's going to be the high risk individuals, those who are going to be coming in contact with COVID quite often, and those that are going to be at high risk of mortality. So to make it pretty simple, all the people who were at one point healthcare heroes, a few months back before the narrative changed, those individuals will be receiving the vaccine up front. And then those individuals who are highly affected, nursing home population, those that are over 65 that have, different things that put them at high risk. Those are the individuals that we have the resources for to receive this vaccine. At this point, we are necessarily based off the goals that were projected last year to receive 20 million doses by the end of the year. We're not there. I think we're just close to like 2 million. So we may not have the resources in place and the structures to administer the vaccine to a large percentage of the population right now. So with all that said, I would love for everyone to have access to it. Right now, we don't have the structures in place from a hospital standpoint. You can speak more if the structures are in place right now from a retail standpoint, a community standpoint, but it is challenging to see that. But right now, that's your question. Healthcare professionals who have high risk of getting that, and those individuals who are high risk as far as a nursing home and elderly right
now. Just to add in there, so in the retail area, currently, I know my stores specifically, we have not received the vaccine to give out to the community, but my district has received the vaccine, and there are pharmacists now that are on the front lines going out to long-term care facilities and nursing homes and et cetera, to make sure that community, that population base gets the vaccine first. Like you said, we want to make sure that the people that's in that first group, healthcare workers, the ones who are at high risk gets the vaccine first. So right now we are giving it out to those, but not to the general community at the moment. So retail, that's the retail level.
Absolutely. There's a ton of questions out there after we're doing it. So we talked about a little bit of overview of why, how those things work, and just from a hospital standpoint. So I'll give a little details on how we even did vaccines within the hospital without giving too much information. Since I'm fortunate to work at two different institutions, I've been able to see a little bit of how it's done and talk to one of my colleagues. So initially there was a little issue as far as like who now within this big group of healthcare professionals who are high risk receive it within those. And what I've seen a common thing was those in the ICU, emergency department, and those areas where anesthesia who have high risk events that occur like intubations, like the different procedures that we're exposing ourselves. Those individuals were what I've seen, allowed to have scheduling for that up front. And very quickly after that, you had individuals that were, not in those areas, but also at high risk as well. So I seen really like the first week, these individuals were allowed to get it. And then that next tier, and then now we even till like 2.5 weeks out, most of the institutions, again, most of those individuals that are high risk all have access to the vaccine from one way to the other. There's been a lot of criticism of how we've selected individual people to receive the vaccine, but I think with it's coming so quickly and this being such a unprecedented process, there's going to be that. There's been some information out there for some medical residents at Stanford. Only 7 of those got vaccinated within the first wave of administration, which was challenging, and they used a lottery system, and that was challenging for them, and they caught some steam for that. Neither one of my institutions received that. So it's going to be very challenging as far as the infrastructure within and outside of the healthcare systems. And there's some people who are much smarter than me that can make those things happen, but they have their hands full.
Yeah. I hear you. So let me see what else I got for it. The vaccine. What was on the news recently? This is just a little side note. It was a doctor supposedly getting the vaccine on camera on the news, but they never pushed the plunger in. How do you feel about that?
I'm perplexed by that because, and this goes to a different aspect. There's a lot of, I call it medical clout. Everyone wants to be the first.
Mm-hmm.
I've seen a ton of individuals, when the vaccine came, they want to be the first one to say, oh, I was the first to receive the vaccine. Or I was the first to administer. I did this. I did that. And anytime there's cameras involved and there's a particular way to make an institution or some type of structure look better or worse, there's a propensity to overdo some things.
Yeah.
One thought I had about that was, I know when I went to get my vaccine, I wanted to make sure that I was showing everyone, but at the same time, if something bad happened to me, I didn't want to look horrible. Yeah. So I was thinking, did this guy go get the vaccine, make sure he had an reaction to it, then went back to make himself look a certain way while receiving the vaccine? Did he freak out and stuff like that the first time and look horrible and then go back? There's people, again, it was also published out there, and it made zero sense to me that a nurse passed out when she got the vaccine. She vagaled down, got nervous, and passed out. I'm scared of needles, y'all. I'm not gonna lie. It's not a great scenario for me. And that's something that's not history related. That's not something that makes any sense from a mechanism standpoint. If someone gets nervous, I see people pass out at weddings all the time. People say, oh man, that's why you shouldn't get married.
Yeah.
It's a natural response that people have.
And I've had a situation, it was the flu shot that I gave that was years ago. We did everything to the T. Just that she was just a lady that had a symptom where she just got fatigued and passed out. We was able to call it EMS. We took care of her. She came back and said she had this disorder that causes that, but she appreciated the help that we gave her when she passed out. We jumped in there and helped her out. But fatigue, passing out could be a side effect of any vaccine, not just the COVID vaccine. Whatever. So any more information that you can think of to give the people a little more knowledge about the vaccine to like ease their mind? Because, you know, right now, definitely in the Black community, a lot of people are skeptical about the vaccine. I try to break it down to them, let them know, hey, this vaccine is going to be like just like any other. With the side effects is going to be very similar. We are in a pandemic, so right now we need to make sure that we have herd immunity, that as many people get immunized as possible. You know, any other tidbits or information?
There's a few things I want to touch on, because again, this is a lot of, we're fortunate to be at a position where we have a ton of friends and family members that are not within the medical community, and we have a host of friends that are. And one of the questions I got, and one of the questions I had, is why does the vaccine seem rushed? You know, I think going through the process of how a vaccine is even developed and why it takes so long in the first place. If you are in any organization, you had to go through a process to get something approved, you realize that there's a ton of time wasted waiting on other people to make a decision. Not on your standpoint, but on other people. For example, going through getting a drug out of the PNT, getting to the formulation of PNT. You have to go through all these meetings, and people are nitpicking certain aspects of what you have before them that doesn't have much weight on the drug itself. There's a process that just takes too long for the most part. Vaccine development, drug development. There are so many steps that occur sequentially that are financially based. So if a drug company makes a particular product, they're going to make sure they test it, do these different things up front to limit the loss of money. And there's like 3 or 4 steps that can occur that doesn't usually happen, you know, at the same time, because of if all of it flops, you lose money completely. That process is not an issue now. There's a lot of money that the drug companies don't have to put forward to go forward. So now, if I don't have a process of losing money while making this product, I'm going to be able to move forward and get these processes done. All the studies were actually done. Everyone said, what's their phase 1 trials done? Yes, I went through and pulled every single study, had phase 1, phase 2, and phase 3 studies. They got the information approved prior to this. Another question I got was, it doesn't seem that many people were tested. There was over 70,000 just in the 2 vaccines, just the 2 that's been approved here. There's probably, and I looked at this prior to this, there's over 100 vaccines that was in development.
Yeah, it was
over 100. Now, just in America, we have over 2 million people, you know, vaccinated. So everyone's waiting to see, like, oh, we don't have this here, and then we don't have the safety. We have a vaccine adverse effect recording system that's currently in place as well that continue to monitor for these side effects that most people don't really know about. So we have the data, we have the information a lot more so. And then from is it even effective? I think most people want to know, what does 90 to 95% effective even mean? And looking at the studies, I think it is what we need to make sure we're clear on is saying that within our community, what effective mean is symptomatic COVID. So you have symptoms of fatigue, shortness of breath, headache, all those things, plus you test positive. What it does not mean, and what was not studied in those 2 particular vaccines within the studies they published, was asymptomatic spread. So I'm not going to sit here and try to sugarcoat it and say that we have data that if you get this vaccine, you cannot get it. There's a few others, the Oxford studies, which I believe may be the next vaccine that may be approved in America, because I think just 2 days ago it was approved in Europe. They have data that says that within their study, there's a 60% reduction in asymptomatic testing of COVID. Granted, I don't mean that they can just go out and not wear masks and do these other things, because that's what they have in place right now in Europe. But the study that Oxford did looked at every week, you got a nose sample and you sent it out. every single week. You said that you had symptoms or not. They didn't have symptoms, but they tested positive. A significant amount of those individuals did not have COVID compared to that got the vaccine compared to those that did not. So 60% is what we usually see in flu data. Yeah. We've been getting flu shots for years. That's a standard now. If that data can be replicated in larger studies and larger, what the vaccines that we have now, I think we have something that may get us closer and closer to being back outside, back doing the things that we usually can do in the future again, especially if we get vaccinated at a higher rate. So it's effective within preventing you from getting symptoms. It's very effective in preventing you from getting severe symptoms, going to the ICU, intubation, things of that nature. And again, in those populations that they're studied. So we're going to have more answers to these questions. We know from right now that what safe means is that you can have headache, fever, and chills. What safe means is that there's not many people passing out and dying just because of the COVID vaccine. We know that we're not going a third leg or something like that. We know what effective means, and we know that we have more questions to answer.
Yeah. One thing that you hit on that I want to go back to. You started off this segment and you said people were talking about this vaccine was made pretty fast. It usually went down like how this time with this vaccine, because we were in a pandemic, certain litigations, certain things were able to get through a little faster. They didn't have to go through the waiting period to make sure that the paperwork and everything was correct. And I don't say correct, was they didn't have to take as much time and litigation just to make sure that every step, and they was able to go through each step a little quicker with the data. They got the data real quick. They got the phase 1 done properly and was able to move on to phase 2 properly, and they were just expedited. Just reassuring that the people that, hey, this vaccine has went through the proper procedures and processes. It was just expedited slightly.
Yeah. In the fact that, again, there wasn't much dead space, I like to call it. It's just paperwork wasn't sitting around, because it was the weekend or we had to take out for holidays. These vaccines were approved on the weekend.
Yeah.
If people weren't just hanging out, they got things to do. So that also helped. But again, find people who own businesses, people who operate and deal with money. They understand what it is to move forward without the fear of losing money.
Yeah.
Things happen very quickly. And the last thing I forgot to mention, as far as in the designing of mRNA vaccine, is that we were fortunate to receive the genetic sequence of COVID from China back in January. We have technology now. Once we can get that sequence, that's the hard part. We got the cheat code. We got the code up front. And then we went back and was able to produce a small piece of that to produce a protein. That takes no time. They can do that now with the technology that we have from a computer standpoint. They can print that out in days.
Yeah.
So using mRNA and having that information moves it much quicker. So, and then the research that to do this, people have been doing it at MIT since the 80s. This ain't new. It's new to us because we're not into it. But if you look at the company Moderna, the last 3 letters are RNA. They've been out for years. So this is not a brand new structure. People have been using mRNA with different disease states, with HIV, with cancer for a period of time. But the way that they did it and the phases that they went through, it's not popularized. So I like to also caveat how we made this up. We got lucky by China broadcasting the DNA sequence, and we had like a head start on that standpoint.
Yeah, definitely, man. And just we're in a good era because, like you said, the technology is here for us right now. So it doesn't take long because the technology is here, and we can move quickly using the proper technology, getting the RNA because we have the DNA sequence, and making this vaccine available to the community as soon as possible.
Absolutely.
All right. So just a recap. So the COVID vaccine is 2 different ones. It's the Pfizer, and you have the What's the name?
Moderna. That's how I'm pronouncing it.
Yeah, Moderna to Pfizer. Both of them are 2 series. The similar side effects as the flu shot when you get it. So muscle aches, soreness, pain at the injection site, slight fever, flu-like symptoms. But that does not mean you have COVID or have the flu. Right now, we're giving it out to the high-risk population and healthcare workers to make sure that we get the ones that's going to be able to administer and the ones that have the highest risk first. And what else am I leaving off to make sure that the people have a good overview?
I think just the only thing is just for the communities who are most affected, the Black and Latino communities. I think it's key to know that most of the times when we're studying something, we don't include those populations, and it's hard to make decisions off of that. The studies that we have a large representation of Black and Latino communities that have been studied and having efficacy in those communities. Again, so there's a host of things from a historic standpoint we have to consider, but I'll just leave you with this. Look at the people who are skipping the line to get the vaccines. Look at how things are being done and then go from there, because I see a ton of wealthy, non-minority individuals who are jumping the line to get the vaccine. Mm-hmm. And they were not necessarily the first ones in line a few months ago before the data release. Now that the data is released, just keep your eyes open with that. As everyone like to say, stay woke when it comes to that, because, we can have our reservations. We should, but our reservations should be backed by specific questions that we want answered, equipped with looking for the answers to that, not just talking the talk, just not just conspiracy theories. So stay woke when it comes to that. If you're one of the people that want to wait to see, the average person won't have access, I believe, until probably March, April. I don't know if you're hearing the same thing. There's going to be 20+ million people vaccinated by that time. So stay skeptical, stay curious, I should say. Answer the questions you need answered, and then look at the people who are getting the vaccine. We love to talk about Tuskegee. We love to talk about some of the things that happened in the past, but look at our the study population for those people. Look at the interventions for those people that happened back in the day, and look at them now, because I think it's a little different. And if we stay woke to that, I think we'll be in a better position.
Yeah, definitely. Man, we got to make sure we protect our community. That's number one. In every community, but yeah, we got to make sure we get out here, make sure, and that's why we're doing this podcast right here and informing everyone. One, what is the vaccine? How's it going to affect you, and why you need to get it? Because without this knowledge, a lot of people just going by, and I work at the retail and they telling me, hey man, I'm not messing with that vaccine. I don't know too much about it. I'm like, hey, let me educate you on it. So I can't educate everyone individually. And that's why I wanted to bring you on, so that we both can have this discussion. We can put this out there and we can educate the world at one time, because we got to make sure everyone gets this vaccine and everyone is, practicing herd immunity, so we could get back to our normal or the new normal.
Yes, in any new normal that involves me getting on a plane and going to a different country, I want to be part of. So however we can do that is great. And just pay attention. We talk about the side effects of the vaccine. We're seeing a lot more side effects, long-term side effects of COVID-19. We got to stay woke with that too. There's talks about myocarditis. There's talks about different things that are out there. So we just got to stay woke and, really get ourselves to, empower each other and realize what the real data support. And I appreciate you for having me on to talk about this, because we need to talk about it. We need to talk about the fact that we were skeptical, we were a certain way. Now we have information, we can make decisions off of it, and we just really hope that everyone, the average person who are not in healthcare, can get something out of this.
Hold on, I got one question that just came to me before we get out of here. So someone was talking to me, and they're like, hey, they're giving out 2 things. They're giving out a shot with the antibodies, and then they're giving out the vaccine. They're like, which one should I get? Are they both similar into helping me avoid the COVID-19? Do you know anything about the antibodies vaccine?
I'm gonna be honest, I know very little about the antibodies. I know that some very influential people who got COVID-19 received it. There's some data out there on it that I haven't picked apart yet, so I'm hesitant to speak out on data that I haven't actually read myself yet. But again, I've heard from my ID people that that's part of protocols for them in the outpatient setting. Some of those antibodies are part of the protocol for my institution as well. And the only thing I can say is that the vaccine is for those that had issues, and then those that had COVID-19 and those who had not. The antibody in itself, from what I understand right now, is for those people who have COVID-19 that are mild to moderate that can be used as an outpatient setting. So there's a particular difference within those. I don't think a person that does not have COVID-19 actively right now receives the antibody. It's supposed to be to help you fight that active infection. So that's the only thing I can really speak on.
I mean, I got one more. If you already had COVID-19, should you still get the vaccine?
Absolutely. So what I've seen, fortunately and unfortunately, I know quite a few people who have COVID-19. And we know that those antibodies that were tested in the past it's not very reliable. So if you have antibodies now, it's not necessarily shown to prevent for a second reinfection. So you can be infected twice. And what we're hoping with the vaccine is that we're able to extend that time frame, and we're able to produce an antibody. We produce a protein that can produce antibodies that last longer. And we're hopeful. There's questions: is this going to be a yearly thing? Do we have to get it multiple times? I don't know. I'm not educated enough to make those statements as of right now. But I know that most individuals who had COVID-19 at some period of time last year, I know people who got infected twice. So from my standpoint, I'd rather provide myself with the most immunity as possible. And from a global standpoint, provide that so we don't pass COVID-19 on to other people as well.
Okay, good. Great information. I know you probably covered this too also on your podcast, PharmSoHard, or you probably did it on some of your Friday Pearls. If anybody want to get in contact with you, make sure that they can catch your podcast or get your pearls. Dr. Pruitt, how can they reach you? How can they get some of this information that you're sharing with me today?
Perfect. So you can reach me via email at my podcast at PharmSoHard2019. Again, you can reach me there. You can definitely go to the website, PharmSoHard.com. Or if you want to receive some of the Pharmacy Friday pearls, go to PharmacyFriday.com. You can reach those there. I have all my contact information, or I think realistically the easiest way to reach me is on Twitter. My handle there is going to be PharmD_NED, and I can get back to you there. We can set something up so I can either provide more information, answer some questions that you have, or you just want to, shoot me some hate mail. Go right ahead and reach me on there.
Hey man, I appreciate you coming on Pill Talk with Dr. Bartu. In this segment, we was able to talk about COVID, what it's about, side effects, the population that needs to get it, and everything you need to know at this moment about the vaccine that's out. You can find me at on Instagram and on YouTube at Dr. Bartu. You can follow me and get on to my link at bio.fm/WBAR2 if you want to get some of this good merch. Bigger dreams, less worries. Empower leaders, and also subscribe to the YouTube channel. Thank you, Dr. Pruitt, for coming on, giving us this good information, my man.
No, thank you.
All right.